Welcome to the Real GI Doc Show. I am your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in Long Island, New York. Today's episode is a short but sweet talk about a subject called direct access colonoscopy. What that is it's the concept of coming in for a colonoscopy procedure without the need to make a pre-procedure visit. So instead of meeting me and then meeting me again for the colonoscopy, you would just have to come in once for the colonoscopy. And before I talk about what that is, I guess I'll talk about where the idea came from. I don't mean the idea in general, I just mean like why I'm doing this now. And I think when they lowered the age of screening colonoscopy to 45, what I'm meeting is a lot of young people who are working and have young kids in the house still who are 45 years old, and they're coming in for these pre-procedure colonoscopy visits. And statistically, the younger you are, the less health problems you typically have. So I'm meeting a lot of healthy 45-year-olds and 46-year-olds and 50-year-olds and, even 55, 60, 65-year-olds. A lot of people are staying healthy nowadays. And I'm meeting a lot of healthy people who are coming in for a pre-procedure visit, and they're looking at me dressed in their work clothes or sometimes with their kids sitting there, and they're like, why am I here? I'm healthy. I just want a colonoscopy. So I feel the same way. I'm sitting there looking at them trying to make small talk because I feel like I need to justify why they're coming into the office. And the purpose of this direct access colonoscopy thing is that you could just come in if you're healthy, relatively healthy. You can have a couple of problems. We'll go into that. But if you're relatively healthy, you have well-controlled medical issues and not taking any major medications, you can just come in and schedule a colonoscopy straight up. We'll take care of it on the phone. We'll give you the prep. We'll talk to you about the procedure. We'll ask you some screening questions. We'll have you fill out some paperwork online. And then you just come in for the procedure. You come in one time, one and done. So that's the goal, and that's the concept of direct access. So who's it good for? Who is a direct access colonoscopy good for? Well, overall, it's good for basically healthy people aged 45 to 75 coming in for routine procedures. Direct access is not great if you have abdominal pain or anemia or a change in the bowel habits or some type of gastrointestinal history that you need to talk about. If you have inflammatory bowel disease, chronic diarrhea, significant bleeding, like you see blood in the stool when you go to the bathroom frequently. I'm not just talking about a drop of red blood in the toilet paper. I'm talking about real bleeding, severe constipation, weight loss, other kinds of things. Then it's a good idea to come in and have a consultation because you might not just need a colonoscopy. There might be much more to look for and other tests to do. But if you're just coming in for a routine screening, you're of the age, you're supposed to come in at the age of 45. If you have a family history of colon cancer, or if you have a personal history of colon polyps and you're just coming in for your routine protocolized screening, like every 3 years or 5 years or whatever it is for you, or if you have a positive Cologuard test or a positive FIT test, which are stool-based tests to screen for colon cancer, any of those things, and you're otherwise relatively healthy, you can just sign up and come on in. You don't necessarily need an appointment to meet me. Now, I'm always willing to or happy to meet people because some people are anxious about the procedure or have a lot of questions they want to ask or just want to meet the person doing the, colonoscopy. That's totally reasonable, and that's how we do it now. So that's totally fine to do. Absolutely no problem there. But if you just want to come in and get the procedure over with and move on with your life, direct access colonoscopy is the way to go. So why is colonoscopy important? We've talked about this a million times on this show, or I should say maybe 30 times in this show. I don't think I have a million episodes yet. But colonoscopy is really important because it's probably the best test to prevent getting colon cancer. So colon cancer is a very common cancer. It's a leading cause of death in men and women. It's becoming more common in younger people, which is why they reduced the age of screening onset to 45 years old when it used to be 50 years old. And the problem is that lots of people are not getting screened, and colon cancer is very preventable. If you happen to get it at the typical age, it's very preventable because it starts off as a little growth called a polyp, which is a little growth of tissue inside the colon that grows very slowly over time, goes through stepwise mutations, and eventually can become colon cancer. So we know that everybody who has colon cancer now, if you went back in a time machine a few years prior, you'd find a polyp in that spot, and the polyp is just going to keep growing until it turns into cancer. That's the gist of how we prevent colon cancer, because we do a colonoscopy, we find the little polyps and we take them out at the same time as we're in there. And if we take the polyp out, it's not going to turn into cancer. And polyps are actually a very common thing. we find polyps in my practice about 45% of the time, 45 to 50% of the time that someone comes in for a routine screening colonoscopy with no family history, no symptoms, they'll end up having a precancerous polyp, also called an adenoma. And that number is called the adenoma detection rate. It's one of the quality measures that we look for in colonoscopy. And that number that we find in the community is much higher than you're supposed to find as the bare minimum. So it means that we're doing a really good job at finding these polyps and preventing colon cancer in the community. So the deal is, if you have a colonoscopy and you have polyps, we go in, we take them out, and you're good to go. You have to come back in a couple of years, whatever it is, depending on how many polyps you have, depending on the size of the polyps, depending on the biopsy findings, depending on the family history. At some point, you'll have to come back either 3 years or 5 years or 10 years later. But the colonoscopy and removing the polyps is the thing that actually prevents colon cancer. Now, there's other options for screening, of course, and I've covered this on previous episodes. There's Cologuard testing. There's some other stool-based testing. There's even a blood test out now, but none of them even come close to the protective factor that colonoscopy does in terms of preventing cancer, because none of those tests can find the little polyps that end up causing cancer later in life. So I'll link an episode that I did earlier on Cologuard and a blood-based test for colon cancer. And I talked all about the limitations and the statistics there. If you want to listen and become educated or bored or a combination of the two things, which is really what this show is good for, then I'll link to that episode below and you can listen. But colonoscopy is the gold standard. And the other interesting thing about direct access, the other reason to offer direct access colonoscopy, besides the fact that I don't like seeing people who don't need to waste their time coming in to see me, is it's convenient for the patients also. And it is one less day you have to take off from work early, or one less day you have to drive to an office that might be far away. It's one less encounter with the healthcare system and one less encounter with the insurance companies. And it's one less copay to pay if you have a copay or a deductible or high deductible plan. Not all these pre-procedure visits are always covered well, and sometimes you have to pay a copay or whatever it is with your plan. So it's one less instance where you may have to open your wallet and pay some money to get healthcare. It removes barriers to screening because it's just one more step to take. So it's hard sometimes to make that first step and make the phone call to come in and make the appointment. And then you have to come back again for the procedure. So if you want to get things, just want to get stuff done, make the decision to do it, then you just call up and make the appointment, and that's all you have to do. It's one less thing you got to do. You don't have to come in and meet me again. As much fun as it is to make small talk, I'm sure that you have better things to do with your time. So that's basically direct access in a nutshell. And who can't get it? So who is direct access not really a good choice for? Well, if you have the following conditions, it's probably not a great choice for you. And we're going to phone screen people for these kind of issues, but it's a no-go if you have some of these more substantial or more significant medical issues, because sometimes I need to modify your medications, to figure out your blood thinners, talk to a cardiologist about your risks of holding blood thinners or how to manage a pacemaker that you might have, etc. So the criteria really, or the reasons why you should not come in for a direct access colonoscopy, and these things you can always call for direct access and we'll figure it out, because we're going to send you a screening form. You're going to fill out some things online. We're going to ask you all these questions. So it's not like you have to know all this beforehand, but just so you know, if you're listening, if you have active cardiac disease, so if you have congestive heart failure that's active, you're on diuretics for that. If you have active coronary artery disease, if you recently had a stent put in the heart within the last year or so, if you have certain types of valve problems with your heart, those are all reasons why you should not come in for a direct access colonoscopy, and we would pick that up beforehand and we'd have you come into the office to figure out how to manage everything safely. If you have severe sleep apnea, if you have any advanced organ disease, kidney problems, liver problems, lung problems, any of those things, it's good to come in and talk. If you're taking any type of blood thinner, except for low-dose aspirin or baby aspirin, that's totally fine. But if you're taking anything more powerful than that, it's probably not a good thing to come in for a direct access colonoscopy. We should figure out how to manage the blood thinner ahead of time. And if you have a pacemaker, if you have a defibrillator, that's definitely not a direct access type thing. If you have a history of prior problems with anesthesia, if you have morbid obesity, which increases the risk of all kinds of complications in general, if you have a seizure disorder, if you have a substance abuse disorder, if you have any poorly controlled medical issue, poorly controlled diabetes, poorly controlled hypertension, I would hate that if you showed up the day of the procedure and something was so out of whack that we couldn't safely do it, and then you went through the whole prep. That would really be an unfortunate situation, and I don't want to do that to anybody. So we want to know about that beforehand. So if you have really poorly controlled hypertension, we have to get that under control so you don't show up and your blood pressure is 200 the day of the procedure. And any history of a difficult colonoscopy, prior poor prep or prior problems with colonoscopy, incomplete colonoscopies by a different doctor, any of those things would make it something you should come in and talk to me about, because we can figure out a good way to do the prep without just giving you the standard protocol, because if that's failed you in the past, you don't want to make the same mistake twice. And that's really the story on direct access. So short and sweet. It's a good thing to offer, I think, to the community and I guess the Long Island community at large. So anyone can come over and get a direct access colonoscopy if you meet these criteria. And how does it work? Well, there's a sign-up form on our website. I'll put a link below. And you just sign up. You put your name and your date of birth and your phone number and your email in there and a couple of quick questions. And then we reach out to you and we take it from there. So this is an experiment that we're doing in real time here. I know other practices do this, and I'm just starting to offer it now. So I'm excited to see how it works, and I hope that it opens up the doors to more screening and removes these barriers and increases patient satisfaction and convenience for this important colonoscopy, which can basically avoid you getting colon cancer, prevent getting colon cancer, and it's a life-saving test in some people and many people. So it's important to do, and I'll put the link to the website sign-up form below. And thank you for listening to this episode of the show, all about direct access colonoscopy, with quite a bit of plugging of the new program in my practice. And next week, we'll have an interesting topic about a listener question about constipation, a big problem that affects lots of people. And it's all about a patient with a redundant colon. So good times next week will be had on this show. All right, I'll see you next time. Thank you for listening, and hopefully you'll enjoy the direct access colonoscopy convenience. Take care. Bye.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.